Today's topic is chiropractic care. And I love the topic because I'm a chiropractor, but more importantly because there's such a difference in chiropractic care from chiropractor to chiropractor, right? And I think a lot of people don't understand fully what chiropractic was founded on. Harvey Liller was adjusted by D.D. Palmer, the founder of chiropractic, for his deafness in 1895, Davenport, Iowa, and he restored his hearing. And that was just the start. You know, it made people aware because it was based more on the physical, right? You can't hear. You could hear from an adjustment. That's huge. But deeper than that, the part that I love about it is they believe that there's a force, an energy in the body. Other people refer to it as chi, prana, life force, breath, whatever you want to call it. But it predominantly runs, based on chiropractic, through the nervous system. Everything throughout your spine controls and coordinates everything in the body. So they believed when that was flowing freely without interference, what we call subluxation, right? Just that word too, the definition of sublux, it's below light, below something. You're not working at optimum level, which we all want to work at optimum level. I believe deep down, everybody wants to perform the best they could. So they believed when that was relieved, your body worked at a more optimum level. But make it even more interesting and more powerful, I believe, is that when that was free and your body was functioning at a higher level, you connected to what they called universal intelligence or God. And that to me, that's like the ultimate meditation, right? So that's why I always say to people when they say, well, what can chiropractic help with? I say, well, what can it help with? Based on my definition of if everything's flowing good and everything's moving, everything works better. I think that's very simple. And I think I'm going to borrow someone's Reggie Gold was an icon, in my opinion, in the chiropractic profession. Him and his wife, they did reviews, and they kept it simple and effective. And he used to say, if you have a hose and it's flowing good, there's no problem. But put a little kink in it, you don't get full pressure. And I don't know about you, but when I'm watering my garden, I want full pressure. Or if I'm spraying somebody that I want to get wet. Keep it fun. Something simple does not mean it's easy. Chewing your food till it's liquid. Simple, but it's not easy. Breathing in and out through your nose only. Easy, but not simple. So with that being said, I think the easiest things and the simplest things are the most powerful. But we're not aware enough that these things are so important because we take them for granted mostly. Breath is simple, right? You stop breathing, what happens? You pass out. It's not a good thing, but take it a step further and say balanced breathing, right? What I mean by balanced breathing is you breathe in and out just through your nose. The nose is the predominant way to breathe. There's different yoga practices and different breathing techniques that, use the mouth. But I'm talking about being productive in everyday life. And to me, that's hugely important. If you could do something, you can only do it an hour a day, like practice yoga or qigong or meditate. There's only 1 hour. You got 23 left. But if you could do something that you could utilize throughout the day and it becomes part of who you are, I think that's a beautiful thing. And I think that's what chiropractic provides for a person. You come to the office, you remove spinal nerve interference, and the body just works at a more optimum level. You could tell right after the visit. Like I have a mirror in my office now, a suggestion of one of my patients, because I always say she looks so much better after the treatment. And I don't think she believed me. So I said, I wish I had a mirror here to show you. So I got a mirror. So now I show her. And she's like, wow, there is a difference. I said, yeah, look how much brighter you look. Look how much more relaxed you look. I said, I don't want you to just believe me. I want you to trust me. I want you to feel a difference because that's what I want. I want a person to come to me because they feel a difference and it helps them. There's a thing that we use in chiropractic. It's not chiropractic, it's overall medicine. The activities of daily living and how they're changed. We use them mostly to get paid, right? Yeah, but because if you don't show improvement, like what are they coming for and all those types of things. But they're everyday things, from brushing your teeth to getting in and out of your car, from sitting to standing. If that doesn't improve, what's the point? You don't realize sometimes that our focus isn't just based on health. In terms of the way I define it is feeling good. It's just not about, go and get tested and everything's good, because that could be true 100%, but that doesn't mean you're healthy. Healthy is more about the emotional part, the emotional content. And they talk about that in chiropractic too, the triune of health. And emotional part's a big part of it, just like the spiritual part, right? We talk about mind, body, spirit, and then people try to separate them. I don't think we could. And why should we? How does it benefit you? I don't think it does. One of the questions I get asked a lot about the chiropractic adjustment and the visit, because my visits are a little different than most chiropractors. I'm not saying better or worse, just different. I am who I am, and what I do is what I love to do, and it's been effective for me over the years. Sleep's a big thing. I think sleep is a totally misunderstood topic because I don't care what anybody says. When you're tired, you sleep. Unless you have some underlying condition that's, just crazy, off the charts, or you're all drugged up, you might not sleep. 6 Red Bulls and this and that, and who knows what other drugs people do to keep themselves awake. And another thing, too, I think goes hand in hand with the sleep is, why are people so tired? Why do you need an energy drink during the day? Why do you got to stop and get a six-hour energy drink? What happened just to having an espresso once in a while? You have to look at the flip side of it. And the flip side is, why are you tired? Is it because you didn't sleep? Sure, that plays a huge part. But I think most of the time why people don't sleep is because their mind's racing. So when you drop the mind and you can relax, it helps. There's a couple things I do in the office that people say they sleep better. The adjustment always, I do a more gentle adjustment. When I say gentle, I'm not saying everybody doesn't do a gentle adjustment, because most chiropractors do. But it's how you do it. I'm not chasing an audible or anything like that, but just more how the body responds to my hands being on them and how they relax. And then another thing that I get good relief for sleep that relaxes a lot of people, it's a rapid release. It's a handheld instrument that works on vibration. And that helps a lot. And I usually throw in a little bit of infrared, professional strength handheld infrared to certain parts of the body, depending on what I feel is out of balance, on what the person presented with and where I feel the most tightness, or my hands just feel like something's going on there. And I do those areas, and then they say to me, I've slept much better. Because I asked them, because someone did say to me, oh, you did that rapid release last time and I slept really good. I said, okay, so then we could incorporate that for you, for your sleep. So I structured something for that patient, a little treatment plan, if you want to call that. And it works. It's been working. Another thing that I always get asked is about drugs, right? Why is chiropractic so-called against drugs and all those different things? It's not that we're against it. It's just that, in my opinion, shouldn't be the first course of action, because you're looking for something external to handle something that's internal. The whole thing is, you have to make lifestyle changes. The body never makes a mistake. When you're not sleeping, when you're not in the need for a drug, it's because you don't need it. Your body's telling you. When you need it, you think, oh, I have to do something because, the body's doing things that I don't like. And that's more what it is, what we don't like. And I think it's because drugs are so alluring, because you don't have to change your lifestyle. Right? Our society and our world, in my opinion, is not conducive to health. You don't feel good, you push through it, so you take a drug. Helps you feel better, goes away, but then it comes back, or it shows up in another way. So drugs have their purpose and they have their place, but I focus more on the order, because I don't want to put drugs down. A lot of people make their living selling drugs, not just on the street corners, but pharmaceutical industry. And once you become aware that your body's reacting because of what you've been doing or what you've been thinking, you'd probably be a little less likely to take a drug, because you'd realize that the drug is just pushing it down. I don't think everybody just wants to take drugs. I think that they take it because it makes their life easier, because they need it to be easier. If you got 2 kids and you're working and you're doing all these kind of things, you got aches or pains, you're not going to perform. So you pop something, you feel great. What happens though? You do it again. And the side effects are always there. The side effect could be emotional, that you become addicted to it in a different way. I think emotional addiction is worse than physical, because physical you could deal with. You could take something to help with that. Emotional is tough. And we're all emotional beings. We don't want to admit it, especially men. I'm an emotional eater. I know, I feel a little hard for me to say sometimes, but there's no judgment when you eat, right? Only what you put on yourself, but it's relieving. Right? Your wife's driving you crazy, your boyfriend, or anybody. And you go sit and you relax, have a nice glass of wine, something to eat. You're in peace for those few minutes. That's a deep meditation, if you allow it to be that, right? So when you embrace things in a way that you're aware of, I'm doing this because right now my life is pretty screwed up in this moment, and this 15 or 20 minutes or half an hour is going to give me some relief. Then you know, and then you know how to use it. And then you probably take less drugs. Speaking of lifestyle and how that relates to chiropractic care, for me it's simple, right? Because I try to live it as best I can. But for most people, I think it becomes a little misunderstood, right? Because the adjustment is the most important thing, because it puts your body back in alignment and balance. So when you're balanced, your lifestyle is going to be a little different. You're not going to be rushing around. Your body's not going to be craving things just to satisfy something that's out of balance, because that's what happens usually. I think when we're out of balance, we become aware of things that we should become aware of things. Like you'll crave a certain food or a certain drink when you're out of balance compared to when you're in balance. You know, people should take a little journal and see when their day's going great and they're feeling happy. Write down what they ate, what they drank, and how they feel. And then when their day's going crappy, write it down and see there's a difference. There's definitely a difference. Some people are so blind to it sometimes, and I hate to use those words, sounds judgmental, which it is a little bit, that they don't get it. They don't see, because they're so inundated with life. And it's all about survival when you're in that stage. You know, you just do what you could do. We can't understand why a person overeats or overdrinks fully. We could say we do psychologically and all that stuff. Do you really know? Does a person open up enough to say, you know, because we're too judgmental. When someone's fat, overweight, whatever words you want to use, oh, they don't do what they should. They don't exercise. You don't know. What do you know? What do you know about them? And why do you care? You should care in a caring way. Wow, it'd be nice if this person knew about, you know, chiropractic care and how it helps, not the products that you're selling for weight loss, but for yourself. It's never external. That plays a part to show you what's going on internally, because we're just a reflection. And life is a reflection of what's going on in our heads. And if you don't believe that, take a minute and see what you're thinking about, and then see how you react and see what you do. And then see what happens when you drop that and you just try to be in the moment and feel that. It's very, very difficult to really engage that. Like I said earlier, simple does not mean easy. One of the main things I get asked is, why does a person choose me over another chiropractor? Why are you seeking chiropractic care from me and not someone else? They choose me because I do some breathing, I do some stretching, I definitely do the adjustment. I think that's so important. I think anybody who's a chiropractor and doesn't adjust should just change their title and not be a chiropractor. You know, because no matter what you do after, that's going to help, whether it's nutrition, whether it's breathing, stretching, any kind of exercise. So what I do is I tailor a specific plan for every patient, you know, what they need based on what I found and what they present and what they tell me. So it's very difficult to say, oh, go see Dr. Caruso, you know, because what he does is different. What does that mean to people? It's very confusing. Oh, he don't just pop you and crack you. That I'm putting that down. You know, and you're not in and out in 10 minutes. That's the biggest one that I get. And, oh, you're not in pain? Do you still have to go? You know? And yes, it's because it's important to stay under care, because our lifestyles don't change. When your lifestyle changes, you don't need to come to me as much. And I'm the first one to tell you that. But when your lifestyle changes, things change. But if it doesn't change, then you definitely need to come, because you come in that following week doing the same things you were doing when you first came, and your body's the same. The body never lies. And when you know how to read it and understand it, it helps. To wrap it up, I would say would be the interconnectedness between the chiropractic treatment, adjustment, and care to overall lifestyle, right? Because everything is connected. You can't touch somebody's spine and not affect another part of their body. Actually, that's the goal, right? Because each vertebrae corresponds to a specific organ and a specific meridian and other points that people use. So it's very holistic, very interconnected, because it all works together. You can't separate things. That's why I do focus a little more with patients individually about their thoughts and their beliefs and breathing. I think those three things sometimes, don't get addressed enough, because there's always an emotional component to most things. Even if you fall, how many people say, what were you thinking about before you fell, right? Maybe you got angry because somebody did something to you and you lost your balance and you fell. You don't know. So what I'm saying is, the interconnectedness and the awareness is all connected, and that's one of the main benefits, I think, of chiropractic care. Do me a favor, follow us and like us on social media, and visit our website, NewJerseyTotalHealth.com.